Ladies and gentlemen, let me welcome you to the next ESVO and EESVO webinar of ophthalmology. I hope you are all connected and you can hear us properly. Throughout the presentation, you can write your questions and comments in the Q&A section, which you can find in the bottom of the panel. Your questions will be asked by the host to the speaker at the end of the presentation. If you have any technical issues during the webinar, please do not hesitate to contact our technical support by chat, and we will help you. After the webinar, you will receive a short questionnaire, and I would like to thank you in advance for completing it. That's it from my side, and now I would like to give the floor to Dr. Beranek, and I wish you a pleasant evening.
Thank you, Veronica. And I am very glad to welcome you all to tonight a new webinar issue, which is organized by European Society of Veterinary Ophthalmology and co-organized by ESVO. Topic for tonight is nutraceutical use in veterinary ophthalmology, and the webinar is supported and sponsored by company Dr+Vet Pet Care. Speaker for tonight is Diplomate of European College of Veterinary Ophthalmologists, Dr. Teresa Peña, and I would like to introduce you shortly. Teresa graduated from the Universitat Autónoma de Barcelona in veterinary medicine 1987 and obtained her PhD degree by the same university with an experimental study in penetrating corneal graft in dogs. She completed her ophthalmology residence at the North Carolina State University, and she's working in the medicine and surgery department of the veterinary school in Barcelona. And nowadays she is an associate professor for the ophthalmology and surgery and head of ophthalmology service at the University Teaching Hospital in Barcelona. She's, as I said, a diplomate of European College of Veterinary Ophthalmology since 1999, and she is active in exam committee and in credentials committee. Teresa is very close to us because she was hardly working in European Society of Veterinary Ophthalmology for many years. She was a board member, treasurer, vice president, and finally from 2007 to 2009 as a president. And Teresa's work today and research are devoted to ophthalmology, especially in corneal pathology and surgery, and to the uveitis and ocular lesions caused by infection diseases. It's a very short introducing, and I think I wish you listen and enjoy Teresa's performance. And once more, if you have any questions or any comments, please write it to the Q&A session at the end of the lecture. We will have time to discuss it. Teresa, you can start.
Okay, thank you very much for the introduction. It's a pleasure for me to be here with you. As Dr. Beranek said, I've been connected with the European Society for many years, and it's really a pleasure to be here again. So, okay. So today we are going to talk about nutraceutical use in veterinary ophthalmology. And with this slide, the first thing I would like to do is to declare no conflict of interest for this presentation. Nutraceuticals are not, and easy subject to talk about, and definition depends on the source you look to. They have been defined as any product derived from food sources with extra health benefits, in addition to the basic nutritional value found in food. But what are nutraceuticals? They are non-specific biological therapies used to promote general well-being, control symptoms, and prevent malignant processes. The name came from the combination of two words, nutrient, that means nourishing food component, and also pharmaceutical, that means that came from a medical drug. The FDA definition is more complete and include the fact that they must be given orally. The term was coined by Stephen DeFelice in 1989, and the philosophy behind nutraceutical is to focus on prevention, according to the saying by the Greek physician Hippocrates, known as the father of the medicine, who said, "Let food to be your medicine." Their role in human nutrition is one of the most important areas of investigation nowadays. These products can be classified on the basis of their natural sources, pharmacological condition, and chemical constitution. And most often they are grouped in 4 categories that are dietary supplements, functional food, medicinal food, and pharmaceuticals. Dietary supplements are nutrients derived from food products concentrated in liquids, capsule, powder, or pill form, while functional food includes whole foods and fortified, as well as enriched or enhanced dietary components that may reduce the risk of chronic disease and provide health benefit. And we have many different examples in veterinary, such as those diets that you have here that are introduced to treat or to nourish, sterilize pets, or for endocrine support, neurocare, etc. Medicinal food is formulated to be consumed or administered internally under the supervision of a qualified physician. That means that they have been to be specifically to manage any disease condition, such as the diet that we have to treat urinary problems in cats, or diets for restricted calories. And those are some of the examples that we have in the market. Pharmaceuticals are medically valuable components produced from modified agricultural crops or animals, and this turns the combination of farm and pharmaceuticals. So, in summary, nutraceutical categories are dietary supplements that you see here, that they are, they are represented by pills, the functional food, the medicinal food, and the pharmaceuticals. And today we are going to talk about dietary supplements. Nutraceuticals seem to have a role in antioxidant defenses, cell proliferation, gene expression, safeguarding of mitochondrial integrity, and of course, they have to be used in conjunction with the traditional veterinary medicine for the different diseases in which they have been used. They can be traditional or non-traditional, and the traditional are obtained from microbial, animal, plants, or mineral sources, granting their natural origin. They include essential nutrients in supraphysiological doses, such as vitamins or minerals, extracted food compounds taken for medical purposes. The more used is the fish oils, botanicals and phytochemicals, and prebiotics and probiotics. And nowadays, there are some concerns regarding the lack of scientific literature on efficacy of many of those products that they are already being used, as well as the lack in regulation in all countries. The regulation differs between countries, but there is a lack in all of them because they are considered as food. So are nutraceuticals safe? Well, remember that natural doesn't mean safe, because amanita, mushroom are also natural and they are very toxic. And also many drugs are derived from plants, and even though they have toxicity. So theoretically, some of the products that we use for nutraceuticals may have some toxicity. So the recommendation is to choose products that are specifically designed for pets, to don't use the human ones, and also to use the ones that came from companies with a good processing, and probably, I mean, it will be safer if they came from companies that already work in veterinary pharmaceutical as veterinary pharmaceutical companies. I mean, another example why we must try to avoid the use of compounds for humans is because some ingredients that we may find in those nutraceuticals may be toxic for pets. For example, some of them have garlic or flavonoids that are toxic for dogs and cats, and also the dosage may differ. For example, vitamin D can be very high levels for humans. It's we can take a lot without any toxicity, but it's toxic for dogs and cats. I mean, there is one paper explaining the use of nutraceutical in human ophthalmology, but there is nothing in veterinary ophthalmology. The only paper in veterinary ophthalmology published in Veterinary Ophthalmology Journal is that one that you see here in the bottom of the screen, and it's a paper in which they did 165 surveys regarding presumed neuroprotective therapies for canine degenerative retinal and optic nerve diseases. The use of those for veterinary ophthalmology, it was sent to ophthalmologists from the European College, American College, and Latin American College, as far as I can remember. And how many of them will use them despite the lack of published clinical efficacy data? And many of them, a lot of them were using that medication specifically for glaucoma, for SARS, for PRA, and retinal diseases. And most of them were using the Ocuglo, the vision supplement for other vision supplement for animals, amlodipine, and human eye supplements. Unfortunately, we have no time to go through all these elements, and neither to evaluate their molecular way of action. I mean, here you have a list of 35 elements, but there are much more that are already being used not only in human, also in veterinary, such as the curcuma that is not here, but there is curcuma for pets, and also because there is scarce information of the effect of all these products in dogs and cats, and even more regarding their benefits for eyes. The orange here that you see in the screen are papers that talk about the use of these elements for veterinary medicine, but not all of them are for ophthalmology, and also many of them are repeated along these 35 elements because most of them are used as formulation, so in combination with many others. Also, some of the papers that we have available are in vitro or are in mice or rats or rabbits or humans, and we have very few in pets, in dogs and cats or horses. Most of the molecules that are used nowadays are antioxidants or free radical scavengers, essential fatty acids, prebiotics, or probiotics. In sick and older animals, the free radicals load may be excessive as they have lower amounts of endogenous antioxidants. And this is one of the reasons why we use them for sick and old animals, also because oxidative injury leads to cellular damage, which ultimately leads to disease. And now we are going to try to talk about the uses of nutraceuticals in veterinary ophthalmology. We have, as far as I know, 2 products, one prebiotic and one probiotic in the veterinary market. They both are used mostly for gut health and to improve the immunoresponse, acting in the microbiota, improving the microbiota. Mostly the impromunase used in systemic diseases, but there's a couple of papers addressing the use of Fortiflora, the Enterococcus faecium, to treat cats with latent feline herpes virus. And in this paper, most of the could you please may I stop for a while, because I have a door open here that is making a noise, and it's very difficult for me to be concentrated. Is that possible? That I stop for just 1 minute?
Yeah, you can take a break if you need.
Only 1 minute to close the door.
Yeah.
Okay, I don't know if you heard this P that is behind. Okay, I'm back. Thank you very much, and I apologize for that, but I had like a noise that was making me to don't be concentrated in the talk. So we were talking about the use of Enterococcus faecium in cats with feline herpes virus 1. And I have to say that those cats had latent feline herpes virus, not the clinical signs of herpes virus. And in this paper, they see that this supplement lessened the morbidity associated with chronic feline herpes virus but only in some cats, not in all of them. And this Enterococcus faecium seems to increase the IgA anti-feline herpesvirus 1 in saliva and serum. Also, there is another study that showed that this product stimulates immune function in young dogs. Dry eye disease is very common in dogs and cats, and maybe underdiagnosed in cats and other species. And treatment is not always easy and/or successful. You know that with dry eye disease, we have changes in corneal protection and nutrition that will develop corneal neovascularization, pigmentation, ulceration, and will lead to corneal opacity and vision loss or vision deficiencies. Over the last few years, the diagnostic methods used to diagnose dry eye disease have improved. And years ago, we only had the Schirmer-Teer test and also Breca time, but now we also have other new ways to do that, as osmolarimetry, meniscometry, Fronin test, meibometry, meibography, the infrared thermography, and all these. It's very important to classify the kind of dry eye disease that we have. Historically, we have been divided this disease in quantitative disease and qualitative, but also we may have cases in which we have both cases. Also, there are many studies that show that we will need to look on other tear properties, such as surface tension and other rheological and physical tears property. But they are very difficult to analyze, but they will be very helpful to treat this disease in the future. So the use of fatty acid has been suggested for the treatment of the ocular surface diseases, and the one that is most used is the omega-3 fatty acid. They can be used, the omega-3 fatty acid can be divided for the length of the chain. It can be short. There is the ALA, and this one, the alpha linoleic acid, is obtained from plants. And also we have the long chain, which is the DHA and EPA that came both from fish. And they have been shown to participate in the reduction of inflammation through the competitive inhibition with arachidonic acid, as well with the cyclooxygenase. It is very important, the ratio, not only the quantity of fatty acids in the body or the omega-3. It is very important the relationship between omega-6 and omega-3. There must be at maximum 4:1. The increases in omega-6 fatty acid has been in the ratio has been related with the potentiation of the chronic inflammation. So this is very important. And sometimes if we have this chronic inflammation, we may try to give or increase the omega-3 in the body to change this ratio. In this case, I found many omega-3 fatty acid marketed for veterinary use for both dogs and cats, and also I've seen one for horses. In In some of them, it is possible to see which is the composition of those products. In other ones, it is very difficult to know. Some came alone. This is the only component of the formula. But in others, there are other components, such as some vitamins, and those normally are more expensive. And we have some of the products that have this omega-3 are the well-known Ocuglo and also the Lacrimalis from Dr.Vet. We only have a couple of papers regarding the use of omega-3 fatty acids in small animals. Specifically, we have that one here, that is the clinical evaluation of nutraceutical diet as the adjuvant of pharmacological treatment in dogs affected with keratoconjunctivitis sicca. Those dogs received the normal treatment for the keratoconjunctivitis sicca, and they have two groups of dogs, one with placebo and the other one with this product. The nutraceutical diet used in this evaluation was a commercial mix formula based on fish protein, and that was previously used in dogs with Leishmania infantum, and in these dogs they found a significant increase in the immunomodulation, and they found the decreasing in type 1 helper cells, lymphocytes, and increasing the T regulatory T cells in those dogs. In this study regarding the keratoconjunctivitis sicca, they saw a significant amelioration of the clinical signs and the reduction of the ocular symptoms that were related with the immunosuppression of this disease. And interestingly, they also see improvement in dogs that didn't respond well or not at all to the conventional medication. The other study, it was also for dogs treated with keratoconjunctivitis sicca. They had dogs that were randomly distributed in 3 groups. It was a double-blind study, and they used a compound that was more rich in IPA than in DHA. And another group in the opposite, and a control group. And interestingly, they saw an amelioration and decrease in the clinical sign in all dogs with the omega-3, but they saw better responses or better reduction or more reduction in those that had the omega-3 with more EPA than DHA. In this study, they found that the record time was longer, so was much better, and they also saw increasing in the Schirmer test, but this can be attributed to the tacrolimus that was also used in this study. In humans, there are many studies using these omega-3 fatty acids in the dry eye syndrome. In some studies, there is an increase of the quality of the tears, but not the quantity, while in other studies, they also find an increase in the quantity of the tears, so increase in the Schirmer TRTs. And in almost all of them, they found improve, also a decrease in the score that they use to quantify the clinical signs in keratoconjunctivitis sicca in human beings. Interestingly, there is one paper that used the linseed oil, so the vegetable derived one, to treat rabbits that were experimentally induced for keratoconjunctivitis sicca, and they also see very good results with these components. But then we have here one study. In this study, what they do is to put together all the information, all the papers that they had regarding studies for administration of omega-3 fatty acids for humans with keratoconjunctivitis sicca, and in general, they see that the results are very variable in between those different studies. They also saw that in some studies in which they used the olive oil as the placebo, the difference between omega-3 and olive oil are not very high. So they're very similar, but it's another kind of fatty acid, but that in that case came from vegetables, not from animals. And at the same time, they say that dry eye is a very complex disease, that we have not only many different etiologies, but also many different clinical signs. We have cases with only tears deficiency, quantitative deficiency. We have many others in which it's a qualitative, and for that reason, we need to pay more attention and to well establish which kind of keratoconjunctivitis sicca are we treating in the studies that we do with those products to establish better which is the use of those products for this disease. So to establish if we are using the formulation for aqueous deficiency dry eye, for evaporative disease dry eye, or in cases in which we already have clinical signs in the cornea. And the question now is, do we use nutraceuticals in dry eye disease? And the answer is yes. We mostly use them in evaporative dry eye disease more than in aqueous deficiency dry eye. We are starting a study about that, but it is very complex. If we want to have unequivocal scientific evidences, even I don't know if we if this will be completely possible, because it is very difficult to obtain patients that came from the same moment in the disease to be very homogeneous for the study. And if we have a very heterogenic population in the study, it may give also heterogenic results. And nowadays we are also thinking to use these products in aqueous deficiency dry eye. I mean, in keratoconjunctivitis sicca, that is not responsible to the typical medication, only because, of course, we are not thinking that it will increase the GMRTR test, but if there is some amelioration in the quality of the tears, they may improve also clinical signs, but we really don't know yet, and we use either Ocuglo or Lacrimalis from Dr+Vet. Cataracts are lens opacifications, and you know that any changes in lens nutrition oxidation status, hydration status, etc., will do changes that will finish in lens opacity in all cases. I mean, it has been shown that antioxidants are very important for the lens health, and vitamin C, vitamin E, vitamin A, and lutein may reduce the risk to get a cataract. It has been shown this in humans. There are not a lot of papers addressing this subject. We have two different marketed products to treat or to try to give antioxidants to make the reduction of the cataracts in the veterinary market, which that are Ocuglo and Dr+Vet. And we have to say that those products are not to treat the cataract. They has been thinking to be used to decrease the progression of the cataract or to delay the initiation of the lens opacification. There are very few papers of the use of nutraceuticals for cataracts. Most of the papers are in rats, in rabbits, in mouses, in humans, but not in dogs or cats. As far as I remember, or as far as I know, there are only two in dogs. One is that one that used Ocuglo to in dogs with diabetic cataracts, and they try to delay the evolution of the cataract. I mean, in their results, they say that the group that was taken the medication, in that group, the cataract was complete in more days. It took longer to have a complete cataract, but there are a few problems in this paper. For example, we have no information regarding glycemia of those dogs during the research. We have that they did the fructosamida in many different. I mean, every month, as I remember correctly, and also the pathophysiology of the diabetic cataracts is very few through oxidative part. Most of them is through the aldose reductase and sorbitol. So we are not sure about the reality of this paper. Also because looking the pictures, we only by the way that the light is reflected in the tapetum, we may think that the opacification is more advanced or less advanced. The second paper that you have here in the screen was published 2 years later, and it is also not very clear regarding the glycemia. It was also given to dogs with diabetic cataracts. And in that case, they use the alpha lipoic acid, and they use it because its properties inhibiting the action of aldose reductase, but those properties are minimal for this product in vivo, and the only effective product is the topical kinostat. And the question is, do we use nutraceuticals in cataracts? And the answer is no, we don't. It doesn't mean that they may not help, but we think that they may help in preventing cataracts. So given as a complementation by the intaking of all these antioxidants, they will decrease maybe the possibility of having a cataract in the future. But I have to say that it is very difficult to perform studies that shown if those products are really helping or not, because as you all know, the progression of a cataract is very variable. It's variable between individuals and between and even between eyes. You know that one eye may in one eye we may have a complete cataract, and the other eye can be only very initial. So it will be really very difficult to find a study that will show if this really help or not. But of course, it doesn't hurt. So I think it can be used, but we don't, as I said. Canine glaucoma, you know, is a very complex group of active neuropathies that they have in common that they induce changes in the intraocular pressure, and these very high intraocular pressure induce the loss of the ganglion cells and their axons, resulting in optic head and retinal degeneration. And the important thing in glaucoma, one of the very important things in glaucoma, is that the neuropathy is perpetuated once started. That this is important. Even if we reduce the intraocular pressure, neuropathy is there. And neuropathy tigers are not fully understood. So we have here, I mean, one of the tigers is the oxidative stress. We have this paper here, and in this paper, they found the increased immunostaining for oxidative stress markers that were seen in retinal ganglion cells in acute glaucoma, but not in chronic glaucoma. And at the same time, they see the immunostaining for the antioxidant glutathione that was very reduced, but not for glutamate. The glutamate was very high, the immunostaining. So the oxidative changes were no longer present in chronic glaucomatous retina, suggesting transient oxidative stress occurring in early glaucoma. The second tiger seems to be the excitotoxicity, for which we have high glutamate and aspartate concentration that induce ischemic mechanism for retinal ganglion cell death and optic nerve atrophy in dogs. And you have here a couple of papers showing these results. We know that we also have excess of calcium intracellular in the ganglion cells in the retina, and neurotrophin deprivation. Neurotrophins exert a protective effect on neurons, and its production is regulated in the retina, but the transport from the brain to the retina is crucial and is stopped in acute glaucoma by the retrograde blockage of axonal transportation. And finally, in glaucoma, we also have inflammation and autoimmunity against the optic nerve antigen and reactive gliosis. So we all know that unfortunately the glaucoma medication and also glaucoma surgery doesn't work as well as we would like. That and for that reason we need to find other ways to prolong the vision in the eyes of our pets. And for that reason, we are intending to use neuroprotection, especially in canine glaucoma, but also in feline and other glaucomas. That paper, it's talking about the presumed neuroprotective therapies prescribed by veterinary ophthalmologists for canine degenerative retinal and optic nerve diseases, as we said before. A neuroprotector is any substance that mitigates or delays neurodegenerative processes, so apoptosis or degeneration in the retina. And the main challenge in glaucoma is to avoid the continuous loss of retinal ganglion cells. That you know that it goes the speed, the normotation, the speed we can control intraocular pressure. And also we need to remember that ganglion cells do not regenerate and cannot be substituted as for now. I mean, we'll see in the future, but not now. So neuropathy treatment needs to be added to the ocular hypertension treatment. Several neuroprotective strategies has been successful developed to be used, but they have been good results in the laboratory, but not in the clinical trials for humans and neither for dogs or cats. So for the neuroprotective agents, we may divide them into groups, the nutraceuticals and the drugs. We're going to talk first about nutraceuticals. The first one, and in this case, I'm going to talk specifically about the products that we are using in our clinics nowadays. The first one is the OcuGlow. The OcuGlow has lutein and also have other components with anti-oxidative properties. So they will act in the oxidative stress. But remember that this stress is mainly so in the acute phases of the canine glaucoma. As OcuGlow, Glauco also helps with the oxidative stress. They also has antioxidant. But this product has gringo biloba, that it's a product that came from berries, and it has been proven in some papers that you may see here that in research that in this research paper in chronic glaucoma in rats and in normal tension glaucoma in humans. This product may preserve ganglion cells from death. And there is a paper in which this gringo biloba, that I don't know very well how to pronounce it, shown a mild but significant reduction in IOP in humans, in a group of humans with open-angle glaucoma, but only about 1.9 millimeters mercury, which is almost nothing for our patients. The pharmacological properties of gringo biloba include the antioxidative effect, the stabilization of the mitochondria, anti-inflammatory effects, and also, which is very interesting and is shown in this paper, vasorelaxative properties. In this clinical paper, this product was used in patients with open-angle glaucoma, and they see that it decreases the vascular resistance and increases biomarkers on ocular flow within retinal and retrobulbar vascular beds. So it was good not only for inflammation and oxidative stress, also for perfusion of the retina. The coenzyme Q10 has been also proposed for its antioxidant activity, and it comes with some formulation with other antioxidative compounds. And finally, it has been published a potential role of cannabinoids in IOP and neuroprotection, reducing the excitotoxicity of glutamate with preliminary results in humans. So it would go against glutamato and aspartate. And it could be an idea to use them together with drugs that also have neuroprotective activity, or maybe don't use all together, but to use one with one specific action, and then to use another with another specific action, to see if this will help more our patient. But I mean, it's only a suggestion because there is nothing investigated about that, and I really don't know, but it may help. And these drugs that are used nowadays are the amlodipino that helps to prevent the excess of calcium intracellular. Also the memantine, that it's a glutamate receptor antagonist. And also the acetylcholine, that it's also acting against the excitotoxicity of glutamate and aspartate, protecting the retinal ganglion cells. And you have here some of the papers that show that this protection exists. And we also have marketed acetylcholine for pets, for dogs and cats, because it's a neuro-CDP. And the question is, do we use nutraceuticals in glaucoma? And the answer is yes. Yes, of course, very often, because as I'm sure all of you, we are desperate because the cases of glaucoma that we have, and we always want to keep the scene as long as possible, as much time as possible. So, and we use, I mean, all of them. And hereditary retinal diseases are mostly associated to photoreceptor or RPE. In all of them, there has been described oxidative stress in different ways. And nutraceuticals has been used to treat retinal diseases in humans. And mostly they has been used to treat retinitis pigmentosa, but also age-related macular degeneration and retinopathy associated with diabetic, so diabetic retinopathy. In retinitis pigmentosa, there are many papers addressing the use of vitamin E as to treat the oxidative stress, and there are some papers showing that helps in different genes anomalies of retinitis pigmentosa in people, and seems to slow the progression of the retinitis pigmentosa in children. But even if they didn't lead to relevant clinical improvement in vision in those children, the disease goes slowly, and also in some adults, or in cases in which they have a very a form that is very I don't find now the word, excuse me, that it's very very bad. They also decrease the progression in those cases. Other products used for those diseases are the coenzyme Q10 to protect those the retina, and also for the age-related macular degeneration and the proliferative diabetic retinopathy has been used the lutein and zeaxanthin together with omega-3 fatty acids. And the prevention of disease progression and reducing the severity has been shown to be equal to the reduction in progression that had people or individuals with a good diet and habits. So people that eat fruits, vegetables, that use sunglasses. So we must say that this lutein and zeaxanthin need to be administered very early in the disease progression, and it's something to slow the disease but not to treat it. The lutein is a hydroxycarotenoid that has been shown to be concentrated in the macula, in the photoreceptor outer segment, in the RPE, and also in the outer plexiform layer. It's a yellow pigment that seems to be a filter of the blue light that has a high energy, while carotenes are antioxidants that are transformed into vitamin E. So these three formulations have lutein. All these three formulations are specifically for veterinary use, and there are no papers addressing the doses that we have to use in veterinary medicine to treat hereditary retinal diseases, and neither how much time we have to use it or which are the results. And also in this disease, it will be very, very difficult and very long to do research to really show if they are or not effective enough. There is one paper, which is that one, in which it has shown that lutein function in dogs seems to increase the production of IgG, and thus stimulated both cell-mediated and humoral immune responses. And this is why it maybe could be used to treat SARS or diseases in which we have inflammation. And this is the reason why Okuglo, in the paper that we have seen at the beginning of this talk, many ophthalmologists were using Okuglo to treat SARS because of this IgG production and increase in the immunity in those dogs. And a paper published in 2004 questioned if knowing the efficacy of many of those products, if we may think in an ideal ocular nutritional supplement for humans in that case. And they suggested that a very good supplement to treat humans to prevent ocular diseases has to have vitamin E and vitamin B for the production of rhodopsin and the prevention of lipid peroxidation, vitamin B and C for cataract prevention, theoretically, beta-carotene preventing free radical formation, lutein and zeaxanthin to improve visual function, and in case of humans, to reduce the evolution in age-related macular disease, selenium for the prevention also of cataracts and to activate the glutathione peroxidase, so to help with the oxidation. I think that it's an essential component of antioxidant enzymes, but regarding the zinc, there is a risk for adverse effects. So it has to be included with caution in these formulations. The gringo biloba that has been shown, as I said before, that increases vasodilation in normal tension glaucoma, so they help for the vascularization in glaucomatous retinas, and the vitamin E as an antioxidant. And I would like to add for veterinary uses the omega-3 fatty acids. So in conclusion, we think that nutraceutical has to be used to prevent diseases more than to treat diseases, but in some cases, such as the ocular surface diseases, the dry eye disease, it could be also used to treat diseases. That more clinical research need to be done on nutraceutical efficacy in veterinary ophthalmology. Then we have to realize that some clinical trials may be very long and difficult to do and to interpret. That studies need to be done to find the optimal dosing of essential fatty acid as well as other nutraceuticals to establish and to establish the duration of the treatment for ocular, specifically for ocular surface diseases, but also for other ophthalmic diseases, and to establish if other combination formulas could be optimal to treat pet eyes. So I think it is very good to work together with enterprises that are producing those nutraceuticals specifically for pets, and to remember that nutraceutical doses for humans and pets may be different, and also the needs. And I would like to thank you for your attention. I mean, it's a very complicated talk because we have not a lot of clinical evidences, but I will be happy to answer any question that you may have.
Thank you, Teresa, for your lecture. As you said, the topic is not easy, and it's not easy to understand everything right now. That's why our members will have the opportunity in the future to download it, because your presentation was recorded and we will put it in a passworded area in our web page. As Teresa said, you have right now time to write questions to Q&A session. And before you start it, I would like to inform you about the meeting, our annual meeting, which will be held in Rome in 2023, the last weekend in September. And the topic of this annual meeting is ocular diagnostic imaging. You see that it will be a 3.5 day meeting with the plenary session and with a very famous HED session, which will be held by Adolfo Guandalini. And there are another two great speakers, Ursula Dietrich and Anna Groth, and they are going to inform you about diagnostic imaging. The last day, it's a Sunday, and we are going to open 2 workshops. One will be about the surgical treatment of glaucoma. The speaker and the course master here will be again Adolfo Guandalini, diplomate of European College of Veterinary Ophthalmology, and it will be about the using of glaucoma implant and about the prosthesis in a surgical approach for glaucoma. And the second workshop will be about the ultrasonography, and both speakers, Ursula and Anna, are going to help you and train you how to use a different machine, different equipment, and different probes for ophthalmology. This is the basic information about the meeting in Rome during the last weekend in September. Please look at your calendar and don't miss this event. And now it's time for Q&A, and the first question is here from Alessandro. And what is the percentage of pets which receive nutraceuticals into your clinic?
The percentage, I mean, it's difficult to say that, but we use nutraceuticals for glaucoma in almost all patients if the owner want to pay for the treatment, and also in many retinal patients, and we are using them more and more also for the surface diseases. And the problem with the nutraceuticals are that they have to be used for a long time. It's I will say a chronic treatment, because as I said before, it will prevent those diseases, and the prices of this is important. So, for example, for us, Ocuglo is for many owners is very expensive. It is not for one bottle, but it is for to treat it for I don't know, for 1 year, and especially if it's a big dog. But I really don't know the percentage, but we use it.
Okay, thank you. And maybe from my side, one technical point, because Ocuglo is coming from the US originally, and there is a branch in the UK right now, and we have the problem to get it in our country because of UK is not anymore member of EU. Are you going to buy Ocuglo directly from the US, or are you using the UK office?
Excuse me? That to buy the...
To buy Ocuglo from the UK or from the US directly?
Well, I mean, it's a problem for us because it's problematic both to have it from UK and also from US. And I have to say that lately we are using the Dr.Vet products because they are based here and they are cheaper than the Ocuglo. And compounding is also it's very similar. I mean, it depends because Ocuglo is the same compounding for all diseases, and for the Dr.Vet nutraceuticals, they change depending the disease you are treating. So I mean, if the owner wants to buy the Ocuglo, we let the owner to buy it directly from internet.
Thank you. And I know that Ocuglo is made for small breeds and for large breed. This is the same for the drugs from Dr.Vet Pet Care as well.
Yes, I mean it's the same formulation, but I mean there is one case in which we have two different formulations, but you may give half of a pill or one pill and a half. I mean, I didn't talk about the dosage, but it's easy to give. It's very easy to give, and they are changing all the products to be adapted to our pets to facilitate to give this medication. But yes, it's possible to give to all of them.
Thank you. Are there any questions or comments? Yeah, that's one more is coming.
Yeah.
A little bit more about what we can use for equine patient, if you have any experience for horses.
No, now we are not using anything for equine, but it's something that needs to be also investigated. I have to say that investigation in nutraceuticals, as I said before, is very difficult. And maybe, I mean, because, you know, we will need to have our patient in the same moment to really have results that may be scientifically correct, and this is very difficult. So we may choose to have multicentral studies to collect cases from different places, to do studies that may show if they are working and how they work and in which conditions, and etc. And for horses, I mean, we are not using them, but I think they may be also interesting.
Okay, thank you, Teresa, for your answer. I don't see any other comment, any other question. That's why I would like to thank you, Teresa, for your presentation. For one more, just good evening. If you have any opinion on Ocuregen from HippoVet.
Which one?
Ocuregen from HippoVet. This is a question if you have been using or have an opinion on it.
No, I don't know that one. I've been looking in internet if I could find others, and no, I didn't find that one. I never use it, and I don't know. I don't know the composition, but I may investigate about that one. I mean, no, I'm sorry.
Thank you. Just once more, thank you for your lecture. As I said, this is a very difficult topic for late evening. That's why your lecture been recorded, and all of our members, I mean paying members, will get the opportunity to download it in the future from our web page. I would like to thank you not only to Teresa for her presentation, but to company Dr.Vet Pet Care for support, to Garant company for technical support, and finally to all of you for listening us, for sitting with us and enjoying this presentation. And hopefully I see you, all of you, in Rome in September 2023. Thank you and have a nice evening.
Thank you.
Thank you. Bye-bye.
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 Thank you very much.